Pulling a muscle, a common occurrence in the realm of physical activity, is a term that refers to the overstretching or tearing of muscle fibers and their accompanying tendons. This condition typically transpires when the muscle is subjected to an abrupt and forceful movement beyond its usual range of motion. The result is pain, discomfort, and potential limitations in mobility. Understanding the causes, symptoms, and treatment of a pulled muscle is essential for anyone involved in physical activities, as it can affect people of all ages and fitness levels. A pulled muscle often arises from actions that involve sudden and strenuous contractions, such as lifting heavy objects, performing explosive athletic maneuvers, or even slipping and attempting to regain balance swiftly. These actions can place excessive strain on the muscle, leading to the damage of muscle fibers or the connective tissues that attach them to bones. The severity of the pull can vary from a minor strain with minimal damage to a more severe tear requiring medical attention. One of the primary indicators of a pulled muscle is pain. This pain typically manifests at the site of the injury and can vary in intensity. A mild pull may result in a dull ache, while a more severe tear can lead to sharp and stabbing pain. Additionally, the affected area may become swollen and tender to the touch. Bruising can also occur, particularly if blood vessels within the muscle are damaged during the injury. Accompanying pain, a pulled muscle can impair the affected muscle's function and range of motion. Simple tasks such as walking, lifting, or reaching for objects may become challenging. Muscle weakness is another common symptom, as the damaged fibers struggle to contract effectively. The severity of these symptoms depends on the extent of the muscle damage and its location within the body. Treating a pulled muscle involves several steps. Initially, it is crucial to rest the injured area to prevent further damage and facilitate the body's natural healing process. Applying ice to the affected area can help reduce swelling and alleviate pain, while compression with an elastic bandage provides support. Elevating the injured limb can also reduce swelling. Over-the-counter pain relievers like ibuprofen may be used to manage pain and inflammation, but consulting a healthcare professional is advisable, especially for more severe injuries. As the healing progresses, gentle stretching and range of motion exercises can be beneficial to prevent muscle stiffness and promote recovery. Physical therapy may be recommended for severe cases or for athletes and individuals requiring a quicker return to their activities. It is essential to listen to one's body during this process and avoid pushing through pain, as it can exacerbate the injury. In summary, pulling a muscle is a common injury caused by the overstretching or tearing of muscle fibers and tendons. It arises from abrupt, forceful movements that exceed the muscle's usual range of motion. Symptoms include pain, swelling, tenderness, bruising, impaired function, and muscle weakness. Treatment involves rest, ice, compression, elevation, and, in some cases, physical therapy. Patience and adherence to the healing process are key to a full recovery, ensuring that one can return to their regular activities without the risk of re-injury.